Hi guys, I'm Snega and today my topic is about inserting the nasopharyngeal airway. Before talking about the steps of inserting the nasopharyngeal airway, let's talk what do you mean by nasopharyngeal airway. So nasopharyngeal airway is a soft rubber or else a plastic tube that's been inserted into the nostrils and advance along the floor of nose. Nasopharyngeal airway is also called as NPA, which is designed to provide the airway passage from the nose to the posterior pharynx. It can be used for both responsive and irresponsive patients. For example, in an instant where the patient is unable to use orthopharyngeal pathway, it is good if it is recommended the nasopharyngeal pathway. Nasopharyngeal airway is produced in variety of sizes to accommodate the various patients. So it's important to select the correct size to nasal airway. The nasal airway begins by visualizing the patient nerves and then selecting the nasal airway with a diameter slightly smaller than the patient's largest nerve. Once the diameter is determined, then measure the device from the tip of the patient's nose to the tip of the earlobe or the angle of the jaw. The rubber washer can be slid back or forth of the device to ensure the patient proper fit. Lubricate the distal surface of the airway with water or else water-soluble lubricant. If inserting the nasal airway into the patient's right nair, insert so as to follow the normal anatomical curvature of the nasopharynx with the level towards the septum. Direct the nasal airway along the floor of the nose into the oropharynx. If you are going to insert the nasopharyngeal airway to the patient's left nair, then it is necessary to invert their airway so that the level of the airway remains along the septum. Once the nasal airway reaches the nasopharynx, rotate the airway 180 degrees to resume alignment with the normal anatomical curvature of the nasopharynx. Once the nasal airway is in place, last step is to check for the adequate gas